PACE's Preparation Pulse Academy podcast on migraine. Migraine is a condition that causes symptoms such as a severe headache, feeling sick, and sensitivity to light. There is treatment to help manage symptoms. Symptoms of migraine. Migraine is a condition that causes a set of symptoms known as a migraine attack. The main symptoms of a migraine attack are a throbbing headache. This can be severe, often on one side of the head, and can be worse when you move around. Feeling or being sick, nausea and vomiting. Being very sensitive to light and sounds. You may also get symptoms at the start of a migraine attack, such as feeling very tired and yawning a lot, craving certain foods or feeling thirsty, changes in your mood, a stiff neck, peeing more. Some people get warning signs that they're about to have a migraine attack called aura, such as problems with your sight, such as seeing zigzag lines or flashing lights, numbness or a tingling that feels like pins and needles, feeling dizzy, difficulty speaking. Aura symptoms should not last for longer than 1 hour. Migraine attacks usually last between 4 hours and 3 days, with early symptoms such as feeling very tired, starting hours or up to 2 days before the head pain starts and finishing after the headache stops. Some people have migraine attacks several times a week, while others do not have them as often. Migraine attacks that happen just before or during your period are called menstrual migraines. They are often longer and more severe than migraine attacks at other times. Most people find their migraine attacks slowly get better as they get older. In women, migraine often gets better after the menopause and sometimes improves in pregnancy. See a GP if your migraine attacks are severe or getting worse, or lasting longer than usual. You have migraine attacks more than once a week. You're finding it difficult to control your migraine. You regularly get migraine before or during your period. Urgent advice. Ask for an urgent GP appointment or get help from NHS 111 if you have a migraine attack and it's lasted longer than 72 hours. Aura symptoms last longer than 1 hour at a time. You're pregnant or just had a baby. You can call 111 or get help from 111 online. Immediate action required. Call 999 if you or your child have a headache that came on suddenly and is extremely painful, have problems speaking or remembering things, lose your vision, or have blurred or double vision, feel drowsy or confused, have a seizure or fit, have a very high temperature and symptoms of meningitis, cannot move or have weakness in the arms or legs on one side of your body, or one side of your face, have recently had a head injury. You can call 111 or get help from 111 online. Immediate action required. Call 999 if you or your child have a headache that came on suddenly and is extremely painful, have problems speaking or remembering things, lose your vision, or have blurred or double vision, feel drowsy or confused, have a seizure or fit, have a very high temperature and symptoms of meningitis, cannot move or have weakness in the arms or legs on one side of your body, or one side of your face, have recently had a head injury. Important. Try not to take painkillers for more than 2 days a week, as this can cause you to get more headaches and make migraine harder to treat. Causes of migraine. It's not known what causes migraine, but it happens when there are changes to nerves and blood vessels in the brain. You're more likely to get it if you have a close family member who has it. Women are also more likely to get migraine than men. Some people find certain triggers can cause migraine attacks, such as having your period, anxiety and depression, stress and tiredness, skipping meals or not eating regularly, too much caffeine, not getting enough regular exercise. It can help to keep a migraine diary to help you work out what might trigger your migraine attacks. Things you can do to ease or reduce migraine. There are things you can do yourself to manage migraine, with help and advice from a GP. Do. Try sleeping or lying down in a darkened room during a migraine attack. Try to avoid things you know trigger your migraine attacks. Stay well hydrated, and limit how much caffeine and alcohol you drink. Try to keep to a healthy weight. Eat meals at regular times. Get regular exercise. Get plenty of sleep. Try to manage your stress. PACE's Pulse Academy presentation.
Thank you for watching. Don't forget to like, comment, share, and subscribe to the PACE's Pulse Academy YouTube channel to stay updated with the latest PACE's scenarios.